Hello, and thank you for joining us. Please be aware that all attendees have joined us in listen-only mode. However, we encourage you to use the Q&A feature throughout the webinar as we've allocated time at the end of this session to address questions submitted. Before I get started, I'd like to introduce myself and all of us on the line here with you today. I'm Ricky Jennings, Zebra's Chief Nursing Informatics Officer. My role works alongside our customers and our partners every day as they increase the utilization of technology to automate clinical workflows. I'm also joined by Eric Holmes, Vice President of Sales at Strategic Mobility Group. Eric has over 25 years of industry experience, is the co-founder of SMG3, and is an enterprise Android architect specializing in healthcare mobility as a platform. And last but not least, both of us are joined alongside by Christina Russell, Associate Vice President of Telecommunications at MedStar Health. In her role, Christina is responsible for overseeing all aspects of telecommunications, which includes clinical mobility devices. Mobile solutions have become indispensable tools enhancing patient care, streamlining operations, and improving communication among healthcare professionals. However, keeping track of those devices in any setting, but especially in the healthcare setting, can become cumbersome. Time spent searching for equipment, or even worse, not utilizing the solutions that were developed to streamline workflows, can completely distract from the value of a solution that was developed to improve patient outcomes. At Zebra, we're committed to developing technologies that unburden the delivery of care. The entirety of our solution portfolio, from legacy hardware to our expanded software offerings, focus on ensuring that every clinical asset and caregiver is visible, connected, and optimally utilized. Across our solution set, we focus on streamlining critical workflows, unifying teams, and provided data-driven insights. During our session today, we're going to discuss a recent implementation of Zebra's device tracker in conjunction with SMG3's Edge Portal, as well as talk about how MedStar has reduced their lost devices to only 1%, which also, in addition, increasing medication administration rates and improving nursing leadership satisfaction. As you can see, transforming care delivery models is a requirement in today's environment. IT and clinicians really do need to partner together to identify data sources that are able to drive strategic change. The statistics you're seeing on the screen come from a global research study that Zebra recently commissioned to analyze investment areas across both IT and clinical health system executives. Feedback from both clinical and IT decision makers who responded to and participated in the survey confirmed that investments in automation to reduce administrative burden are imminent. They're on the near-term horizon and an increasing priority right now. So whether that's from supply chain orchestration to the topic that we're going to dig in and really discuss here today, locating critical equipment, health systems are actively prioritizing maximizing investments by selecting ways to automate day-to-day management, the needs that really in turn improve the way clinicians work and our patients are provided care. Eric, I'd like to kind of turn this conversation over to you to start us in our next section, diving deeper into how we're working together to improve the experience utilizing clinical mobile devices in the healthcare setting.
Yep, Ricky, thank you for the kind introduction and the nice words. Hello, everyone. I'm Eric Holmes. I'm the Vice President of Sales for Strategic Mobility Group. But at the same time, I'm also deeply passionate about how mobile devices are built, delivered, and utilized in a healthcare setting. And really with SMG3 as the leading integrator of Zebra smartphones in healthcare, we provide mobile technology, supplying our customers with an expert support, migration, and implementation of Android in the enterprise. Android brings a unique set of challenges, which also helps us deliver a unique set of end user experiences on the devices that need to be planned for early on when thinking about your mobility deployment. We're here today to talk about finding lost devices or your mobile devices out there in your health system. But that's making the assumption that we have a very good foundation of mobile devices deployed, and we are not struggling with managing that deployment while our end users are having an increased adoption of their applications on the device. And we are really making sure that we are saying we have a couple thousand devices out there, and we want those devices in the hands of the caregivers, and we can go out there and find them when they do get lost, managing our IT assets and holding down our total cost of ownership. So how does SMG3 really do this? So we have a managed services platform backed by a team of individuals who provide consulting, design, project management, configuration, and deployment of the mobile devices while taking into consideration the end user experience. How is the end user going to interact with this device? And how do we build a framework that makes their life as easy as possible while maintaining that device on the wireless network operating 100% of the time, or as close to 100% of the time as possible? Our platform relies on the greatest mobile device in healthcare at the moment from Zebra Technologies. We also utilize their printers, their barcode scanners, and other tablets and RFID technology in healthcare to provide many different workflows. But today we're here to talk mainly about their mobile platform. At the same time, there has to be a software component. Why are we utilizing these devices out there? So from SMG3, we also help integrate Zebra's work cloud communication applications. And today we'll be talking about their device tracker and ZAMS applications. Device tracker allows us to find the lost Zebra devices that are out there, creating the environment where we're having a device in the hands of our providers and our caregivers at the time of need. Who does SMG3 serve? We serve health organizations across the United States, single hospital systems or multi-hospital systems. We have over 35,000 Zebra devices deployed and under current management. That's coast to coast. So we're helping hospitals keep their mobile devices out there, up and running in the caregiver's hands next to the bedside at the time of need when they need it. We're working with EHRs and Cerner, Epic, Meditech, and all the major EHRs out there. And this is just a small example of the workflows or the applications that we are supporting out there today. Any apps coming from the EHR, whether they're from Cerner or for Epic, we're supporting voice communications on the mobile devices, secure texting, med administration, and really the last mile solutions. But really what we're looking for is a fully integrated system utilizing alert and alarm management coming to your devices, nurse call support, and then wrapping the whole entire application with single sign-on on a partner from Imprivata. And who do we serve? Well, SMG3 serves with a clinical focus, providing a user experience for the clinicians and the caregivers interacting with the device is our #1 priority. If we worry about the IT environment first, we are failing our combined customer. And by considering the end user and their experience on the device, we can backwards engineer our support framework as well as any additional applications that we are going to roll out. We utilize a platform where consulting and design through a team of industry experts helps build this platform for our end users and answers all questions in between. How are we going to support the devices through the lifecycle management? How are we going to deploy the devices in the areas that are most important? We're going to rely on our expertise. SMG3, as Ricky said, has over 25 years of experience in the healthcare industry, deploying 35,000 plus devices out there. So relying on that industry experience and utilizing that with our other end users, having that shared knowledge base is helping all of our customers and all of the health systems that we are working with today. We have a team of project managers who are intimately involved in every one of our go lives, as well as data collection and knowledge sharing. And then the technical expertise and partnerships are so important. How do we technically transfer our knowledge set to our customers, or how do we support our customers through the technology and the partnerships with Zebra? Zebra has very specific applications that we're utilizing to build an end user experience that is unprecedented in the healthcare mobile space. How do you have devices that are on your network 100% of the time? How is every single device configured the exact same way? And what do we do when something goes wrong? What is our downtime procedures? How do we get the devices back up and running? Or what do we do simply when a device breaks and we got to get a device in the hands of the caregivers ASAP, because it is so important to them and they don't want to go through their downtime procedures. So the way we do this is through the SMG3 Edge and our device integrity programs. Where we will be at the end of this conversation is where we're discussing our platform, our devices out there across the enterprise at MedStar, running seamlessly every single day, but then finding that lost device. If we spend all of our time fighting our mobile deployment, we really don't get to an area where we're worried about losing devices. We worry about devices falling off the network and things of that nature. So the SMG3 device integrity program, known as the Edge, is a world where you can imagine zero downtime of your devices, zero downtime and learning curve on deploying new apps across your enterprise, a crunched learning curve on how your MDM is supposed to integrate with your mobile devices, or how voice is going to interoperate on your wireless network, a really knowledge sharing system that develops this 100% uptime. And we do this very elegantly through a process ran by our project managers, where we design your implementation, design the outcomes that we're looking at 3, 4, or 5 years from now. Knowing today that we're going to want to find our lost devices 3 years from now when we're at full scale deployment is important, because you have to build the system that way today. And architecting that design now is very important for future success. Taking our knowledge transfer and our customers' input and building a golden image that is across the enterprise and is rigid and is flexible at the same time, being that today when we deploy, we are very rigid. We don't make very many changes, but flexible as things change in the future. Security releases, operating systems, things that Zebra allows us to do that no other mobile technology really allows us to do, is control our operating system, but update it based on security protocol or different changes in the environment or different end user requirements, volume, screen time, things of that nature that we want to change based on the different environments that our end users are working on. It's very customizable. A process that takes the golden image and deploys it into every device is our mobile managed services platform, ensuring that all the devices leaving SMG3 go through a quality control process, are specifically configured to your environment, and that you have the deployment and the support team on staff at the time of need, giving the devices out to the end users, making sure that they're trained, making sure that they understand the new technology, and working alongside our customers' deployment teams to ensure that education and that information is transferred properly, because we are giving a new clinical device to a caregiver who's going to be using it at the time of need at the bedside. It's very important. And then how do we support and manage everything post go live? And that's really where we're going to talk about the cost savings that our combined customer MedStar has found, is managing their devices out there across their facilities post go live. I touched on the golden image, and I don't want to stay too long on this topic, but it is so important to understand that not every Android device that shows up at your facility is exactly the same on day one. Those devices need to be properly imaged, and there is a learning curve in the deployment process for every single customer, whether we have a different wireless network, whether we have a different voice over IP solution or a different MDM or a different EMM that are out there, whether they're different apps deployed to different areas of your hospital. This base image is most important to our future, and understanding its complexities and taking those complexities and turning them into solutions is the foundation for an exceptional mobile deployment across your enterprise. And we're talking a hospital that could be using 100 devices, or a hospital similar to MedStar that could be using thousands of devices across multiple hospitals, 9, 10 hospitals. It's very important to understand day one, this is the most important foundation thing that we're going to do. It helps reduce errors, helps reduce learning curves. I touched a little bit on our managed services that is important is the image creation, the configuration, the deployment of the devices, the technical support, and the lifecycle management. What do we do when a device breaks? You don't want your mobile deployment to fail after it is already deployed because devices are breaking, we can't get them reconfigured, and we're creating new problems. A very strong lifecycle management platform inside of the edge really allows you to lock this down. And we are going to talk about today where lifecycle management and lost devices find an intersection out there, and you can find your lost IT devices, whether, or your mobile devices, whether they broken or whether they need to be put back into service. One platform taking care of all of this for you is really going to ensure a healthy environment. The lifecycle management workflow. How hard is it for somebody to walk out into the hospital and find all of the broken devices and then to manage them on a day-to-day basis? That is a lot of work. It could be a full-time employee. How do we take that time and make it easy so that individual can work on clinical stuff as opposed to managing their mobile environment day to day and really fighting it more than anything? So in my world and in the world of our clients, utilizing our visibility portal is very easy and helps the process, and now gives us our integration point to Zebra's device tracker solution. So logging onto the portal, and then you would locate or receive a damaged device from out there in the environment. You would contact SMG's support team, and either we would help you fix it and get it back out there, or we would create a spare pool. When you create a spare pool with Strategic Mobility Group's Edge portal, you will 2-3 days from now receive a completely configured device based on your golden image that we created a little bit ago together. And in the box that you receive, you will receive your tracking number and all of your RMA information back to Zebra Technologies. Even if we ran over the phone or dropped it and broke it and we just have to sweep it up in a little baggie, as long as we have the serial number, our friends at Zebra are going to fix that device for us. In the meantime, you just take the device out of the box that you currently have configured by SMG3, powered on, and redeploy it. This is how we are building that 100% uptime for our end users and giving them a reliable experience over and over and over again with their devices. So what is really nice from this deployment is that we have taken everything into consideration in our design phase. And the reason I'm talking about the design phase a little bit later here is in order to ensure we've taken all this stuff into consideration. So how have we done your Wi-Fi? One of the biggest complaints we hear out there is our Wi-Fi stinks and the devices are worse on our Wi-Fi, and we're always complaining, but we got to take that out of the equation. So early on during our design phase, we take away the Wi-Fi consideration. How do we develop that end user's UI with the device? And how do we prevent them from common issues, right? And really get them interacting with the device, increasing user adoption. How are we going to integrate our applications on the device and make sure they're interoperating with one another? Making sure that when that secure text comes in, it comes in over top of our phone call. Android doesn't allow that natively, so you have to do some work on the back end to allow different applications to interoperate with one another. Designing the different workflows out there. Maybe they be end user workflows, or may they be technical support workflows. And what does our support structure look like? What do we do on the deployment support, post-deployment support, and whose job is maintaining the devices and redeploying them, and how are we going to handle migrations, upgrades? Those are things that will get delivered through the edge process and the design process. How are we going to integrate with existing or new mobile device management or enterprise mobile management solutions? As far as down as just labeling devices, what's our label look like on the back of the device? Does that match the label that we put on the home screen? All these little things, packaging the devices, and then putting them through a quality control process, eventually leading us to lifecycle management. One of the ways we move through our lifecycle management and our support framework is we look at our support in 4 different tiers. So we look at them as a desktop support application, an application support, the device support, what is going on with that device and how is that device configured, and then our end user support. And as you can imagine, end user support is most near and dear to our hearts because there's not just the end user that's interoperating with the device, but we're talking end users that support those end users. How are they supporting your internal clients to make sure that they are happy and integrating with the device? This is a support framework that our customers don't think about early on, that need to be thought about prior to deploying an enterprise mobile solution, and even before we can get to this lost and found scenario. So let's fast forward. We have a customer, and in this particular case, Christina Russell from MedStar is going to be talking to this a little more in depthly, but we have a customer, they have deployed a couple thousand devices across 10 hospitals. Their nurses have an increased adoption of the application. They are using all of their Cerner applications that are out there to their fullest. And somebody goes to lunch and they lose the device and they can no longer find it. And now whose burden is that? Is it IT's burden? Is it clinical's burden? Are we putting that on the charge nurse or the nurse manager? Well, I would believe that the nurses first complain to their nurse manager and nurse leadership that's on the unit. There's a lot of frustration that we're starting to see out there. And then how do we decrease that frustration? Because we don't want to continue to force IT support issues onto our nursing leadership, because we want them focused on patient care and the patient experience. So in conjunction with Zebra Technologies and MedStar, we developed an application that integrates with our visibility portal, utilizing Zebra's device tracker that is deployed across all of the MedStar devices. So when a device does go lost, an individual can log into SMG3's Edge portal, utilizing one of Zebra's ET40 tablets, and now they can go out there in their environment and find the device. I'm going to simplify this workflow for you, and it's much more intricate, and we'll touch on this as we go along here. But every day in the beginning of the day, or at least once a day, one of our support engineers that is on the ground at one of the 10 different hospitals logs into SMG3's Edge portal, which is integrated with Zebra's device tracker application, and looks for their lost devices. They know how many devices are at that specific location, whether it's 1,000 or 300 at that specific location, and they know how many devices have gone lost for that day. There is a series of data points that allows this individual to locate those devices very quickly. We know the name of the device. We know what unit it's supposed to be on. We ultimately know what hospital it is supposed to be in, sorry. And then they can begin to round and look for these lost devices. Utilizing Zebra's device tracker and SMG3's Edge portal, they can use a Geiger counter function to actually sound an alarm on the device as they get close within a couple meters and actually find the device. That is a simplification. It does take a little bit of time, but over the course of time, you might have 10, 20% losses. Again, Christina's going to talk to this a little bit more, but we're going to diminish those number of devices that are getting lost for the day or being taken home, right? One of the things we've seen is some people take devices home, they bring them back the next day. We are taking that into account in this application. And what are some of the benefits that we've seen? We've seen reduced lost devices in a couple areas from 20% down to 1%. That's real hardware capital expenditure savings, because we're not replacing 20% of our devices annually. We've seen increased med administration via using a barcode scanner, because we have the mobile device in the hands of the individual doing the med administration at the time of need. We're seeing increased satisfaction from our nurse leadership, which is important. We're removing that IT functionality from them. Increased user adoption. They're working with the device more. They trust it more. And we have taken into account their needs And then ultimately, we're minimizing our total cost of ownership and increasing our ROI. We're not out spending more and more money finding lost devices. So from here, I'm going to turn it over to Christina Russell, who's one of SMG's most valued customers. We appreciate her doing this for us. And she's going to talk to you a little bit about a real world experience where they've had thousands of devices across 10 hospitals and some of the data points that they're having. So Christina, the floor is all yours. Thank you, everybody. And we look forward to questions at the end.
Well, hi, everybody. I'm Christina Russell. I oversee telecommunications at MedStar Health. And part of that includes our mobile device deployment. So I'll give you just a little bit of an overview about kind of who we are. So we're a not-for-profit health system headquartered in Columbia, Maryland, but we serve Maryland, Washington, D.C., Virginia. I'm sure we have patients in Pennsylvania and Delaware that come to our facilities as well. Right now we have 10 hospitals. We have 150 community locations. At the current state, we just have the Zebra devices inside of our hospitals. So on the next page just goes a little bit at kind of like what our mobile environment looks like. So we have over 7,000 Zebra devices in our portfolio at the moment. So most of those are out in the hospital. Some of those are back at SMG3's warehouse in our spare pool so that they have the ability to process RMA requests for us. Like I said, we have 10 hospitals. The and growing was on the devices. I hope we're not buying a hospital, but who knows what's out there. From a network perspective, we use Cisco, and I'll talk about why that's important as we go throughout here. From an MDM perspective, we're utilizing VMware's Workspace ONE. I think Eric talked a little bit. We use Oracle Cerner as our electronic medical record. Most of our solutions on the device are from the Oracle Cerner, but we do have non-Cerner applications on our device. So just to review some of the stuff that's happening in our environment. So as Eric said, we do barcode med administration. We have a voice application for inbound and outbound phone calls. We have secure messaging. Our phlebotomy team utilizes the devices. We utilize this for capacity management functions, inventory management functions. What I left off of here, but it's also very important, is alert and alarm management. So we do get alerts from our nurse call vendors, and we're looking at additional alerting functionalities to implement here in the future. So some of those being telemetry and other things. So we're starting to add functionality to these devices that we have in the environment. And our users really span the entire hospital. So I know we've talked a lot about nurses, but we also have physicians, we have respiratory therapists, phlebotomy, dietary, environmental services, supply chain. So this is really an all-in-one device for everybody in our hospital to stay in communication with each other. And like I said, everybody kind of has their piece of the pie on what they do from a solutions perspective. But to Eric's point earlier, we have one golden image. So it doesn't matter what you're doing on the device. We have one standard image that we work with that Eric's team at SMG3 helps us manage. And they're working with us as we go along, deploying additional solutions to make sure that that image works to the solution at hand. Or if we get a request, for example, like how loud should the volume be on the device, or how low should the volume be allowed on the device? We're working with Eric's team directly on some of those kind of settings at the device level to ensure that those are standard across the board so that the users are not getting a different experience based on what device they have. If we move into the next slide, I'll just talk a little about, so we deployed these devices. We went through kind of all the processes that Eric mentioned earlier in his deck around the deployment woes and the golden image. So we've kind of been through that. And so we've got these all out in our environment, and we were seeing a pretty high missing rate. So we talked to Zebra and Eric, and Zebra let us know they had this, nice device tracking software that was going to be coming out. So we started really working with Zebra around what that meant for MedStar Health. And as we got into it, we started looking at this, and it was almost like there was a little bit of information in a lot of different places. So we went to Eric and his team and said, we don't want a lot of information in a lot of places. We'd like information in one place. So we worked with Eric's team, and in his Edge portal, we asked for to have in one location the ability to see what devices we have, what their status is. Are they online? Are they offline? Are they lost? Are they in this can't be found category, which I'll talk a little more about? We wanted to see what device, what the last wireless AP they were connected to. So that's where the Cisco network came into play. So we worked to gather information from Cisco Prime to bring that into the portal so we could gather AP information. We wanted to know the device's Wi-Fi strength. We wanted to see the battery life. And then we also wanted the ability to do custom reports. So as many of you probably know, different groups of users want different dashboards and reports. So we made it really clear to the teams that we wanted to be able to have reports that we could customize based on who needed the info. So we've been working with the SMG3 team on that as well. So we got the portal. We talked through to Eric's team on what the portal looked like. We worked with Zebra and we purchased the device tracker software for both our 5 series and our 2 series devices. So this gave us the ability, as Eric said, with the Zebra tablet, to go out and walk around and use the little Geiger counter functionality to actually find these devices. We also chose to purchase the Bluetooth low energy batteries that Zebra offers. And that gives us the ability to kind of track a powered off device. So if a device has lost battery, we still have the ability to track that device almost up to 7 days if the power's off on that device. And I think that's a key portion of this. If you don't have that battery, you kind of have to track it while it's online. But as we all know, when somebody loses a device, the battery's going to die. So the ability to have that, the ability to track those devices that are powered off became really important to us. So on the next page, I'll just give you a little overview of what our portal looks like. This is one of the initial pages, one of the initial dashboards we set up. In the top left, in the bar graph, that kind of gives us an overview of how many devices currently have device tracker installed. So I said earlier, we have about 7,000 devices in our environment. We've installed this on about 2,000 devices thus far. So we're slowly rolling through, and I'll talk about those next steps. So the big graph, the kind of blue there is how many devices we have. The dark blue, where it says 162, those are devices that are in can't be found category. And those are devices that are still on our network, maybe has low battery or maybe has been idle, but still devices that we're not quite sure. So these are devices that our desk side support teams are out finding. So they take their Zebra tablet out, they look for these devices, and they take them back to the nurse unit on where they belong. So we have shared devices. Anybody can pick up any device and use it. We like to keep our devices on the units where they belong, but that doesn't say that someone comes by and says, oh, I need a device, I picked it up, and they left the unit with it. So if we find those, we can take them back and get them back onto the charger in the unit where they belong. So that 162 is that category, those devices that maybe aren't in the right status, and we need to get them back to the unit and back on the charger. That small sliver of teal is our lost devices. So those are the ones where we've looked for them and we can't find them. And it may be that the last AP was the AP near the door, or, you know, we've gone 7 days of no power on the battery and we still can't find them. So again, that's about 1%. The right side shows days spent lost on a particular unit. So you can see for the most part here, we're almost always under 1 day of a device being lost. So as Eric stated, we're trying to get our desk side support teams in the habit of every day going out and tracking these devices and getting them back to the unit. Obviously, we'll have some outliers here and there that the teams will use. So this is a dashboard that kind of is used by our mobility teams. Our nursing informatics teams have access to some of these dashboards. Our nurse managers have access to these should they want them. On the next page, is what our desk side support team sees. So they would actually pull up this tracker on the Zebra tablet that also has the device tracker software installed on it. And these are those ones where I said to be found. So right now our category or configuration for to be found is it's idle for 45 minutes and has less than 25% battery, or it's completely disconnected from the network. So those are the devices, and this list is rolling. So at any given time, this list updates. So if a device was idle for 45 minutes and had you know 25% or less battery, but someone picked it up and put it on the charger that wasn't IT, this would automatically roll off the list. So the desk side teams are not out looking for devices that may have been picked up and put back into the correct place. So this is constantly changing. It's a real-time list. So they pull this list up, and what you're seeing here is they're able to see the serial number of the device, which is what we use for device name, which is the last column. So we have a device name, and that relates to the serial number. They're able to see the model number, so whether it's a 52 or a 21. On here, also see the access point name. So we have a friendly name, so it tells us the hospital, the building. So this is Union Memorial in the main hospital, and this first one on the list happens to be in the basement. So that at least they know where the last AP it was connected to. So that's the first place they're going to go to start tracking this device, because that's the last place that our network saw it. And then on the next page, just to show you kind of what we've done for our desk side team, is we've also loaded in floor plans with our AP heat maps, so that if there's somebody new to the desk side team or they're not familiar with some of the names, they can actually pull up the floor plan for that particular AP and go to that unit. So this is the 33rd Street 6th floor building. So they can go to the 6th floor, pull this map up and actually look at it. I mean, they'd have to zoom in a little, and go find that AP, and then they can walk to that place and again, start using the device tracker software. So they're going to turn that on. They're going to get the little Geiger counter that's going to get louder and louder and louder the closer you get to the device. And then if needed, they can sound an alarm on the missing device. So if something's in a drawer, or in bed sheets, which we find from time to time, you can actually sound that alarm. For those folks that are similar to setting, your alarm off on your Apple phone, when you get close to it, same thing. So it sounds an alarm so that you can actually go find that device. So that's kind of the process that our teams are using. And just to give a little statistics of kind of where we're at. So we've deployed this at 3 of our 10 hospitals. And you'll see the next 3 pages are very similar in the stats. They're very similar size hospitals. Right now, we're averaging probably 3 to 5% in that category of to be found. So those, again, are the devices that are kind of in limbo. So they're not on the correct unit, or they don't have enough battery, or they've been sitting idle for too long. So if you're sitting idle for more than 45 minutes, we're making some assumptions that nobody's using the device. We need to go find it and put it back where it belongs. Again, we're in the 1 to 2% of can't be found. So we really went, at the bottom here of previous offline rates of 15 to 20% is what we were seeing previous, and now we're 1%. So as Eric stated, those are kind of real hard capital dollars savings for us that we're not having to replace. So we had one hospital where we had a number of devices missing, and we spent $500,000 in capital to go back and replace those devices. So this will give us the ability to not have to do that in the future. Another piece of data that we found as we went through the hospitals is this kind of middle number around idle. And if you go 2 more pages, Eric, I'll talk a little bit around kind of what idle means to us. So, and this is a piece of data that we're still digging into. So it's just something we've recently started looking at. But this is devices that have 45 minutes or more with no activity. And we're kind of working with Zebra because this is a data point that we found and we wanted more information with it. So Zebra is helping us gather more information around idle and tracking that in different ways. So what we're finding is in any given day, we're finding, roughly 50 to 60% of our devices are not being used. And that's about, potentially 300 devices per facility are not in use at any given time, which really in our world comes out to over $1 million of devices are deployed that aren't getting its full usage. So we're working with our nursing informatics teams to really start to, like I said, understand this data. What does it mean? What units, is there a particular unit that's not using their devices? So one of the examples we found is we had a nurse unit. We have devices deployed, but it's really a swing unit. So it's not a unit that has patients, but it's an overflow unit. So it did make sense to us that that unit had idle devices, because that's a nurse unit that doesn't regularly take patients unless we need to. So for example, like flu season or COVID, or where we're getting an influx of patients, we'll open that unit up. So that made sense to us. But then there are other units where we're saying, was that a user education? Like, do we need to go back and make sure they're aware of how to use the devices? Or do they truly not need that many? And can we repurpose them? So we're really taking this data point that we didn't expect to get, but we got when we deployed this software to really talk about how do we best utilize the investment that we have. And again, Zebra and SNG3 are working with us to make sure that we get the data points we need to understand this data We've just initially started looking at it. But again, when we talk about kind of hard dollars and return on investment, which I know a lot of people in healthcare are being pushed to get that return on investment, this is one where, you know, we're able to find the devices, keep them on the floor. We're not replacing them, but then we're also looking at what do we have? Are we using it? And can we repurpose it to a unit that needs it? So a couple data points that we're getting where we're actually seeing some hard dollar amounts coming out of what we've deployed. And I think just around next steps, and this is my last slide, and then we'll turn it over for questions. But so we're in the process of making sure our steady state support team understands this software. So we're working with the local teams at the hospital to make sure they have what they need. Like I said, we're talking about this idle devices and what does that mean, and can we repurpose or retrain? We're still working with Eric and his team on custom reports to make sure everybody gets the data they need. We will be taking some time to look at, we use ServiceNow for our ticketing system and asset management. So we're looking at integration between ServiceNow, Workspace ONE, so that we can integrate the ticketing system with the MDM system so that we can get automated ticketing through there and automated asset management. And like I said, we deployed device tracker at 3 of our 10 hospitals. So we have on the plan for the next quarter for, I think, 3 more hospitals the next quarter. We'll get the device tracker software, and then we'll keep rolling from there. And then the other just next step from our perspective is, so we've solved the where is the device. We haven't yet solved who had the device last. So we're working with Zebra and looking at their Zebra access management solution system called ZAMS to see if that's something we can put into our portfolio, which will help us with kind of electronic check-in and check-out so that we know who had the devices, so that if a device did walk out the door for some reason, we can call up the nurse and say, hey, like, do you happen to have this in your pocket? And can you bring it back on your next shift? So that we can have those conversations, or, hey, we really need that. Like, we need you to turn around and bring it back. So those are some things that we're looking at as well, so that we can just keep track of those devices and keep them in our environment. And then I think, you know, that from my perspective, those are where we're at with next steps. I'm happy to open the floor up for questions. I know Ricky, Eric, and I are happy to help and answer whatever questions you can from our perspective. But I hope that gave some insight into some real world challenges we were having and how we solved for them. We're trying to solve for them. We've still got more work to do, but we've got some good things going.
Thanks, Christina. And as Christina said, moving into questions and answers, and no surprise after that presentation, and the success you've had to date. And I think what's really exciting is your outlook moving forward too, Christina. Like with all things with technology, the work is never done. The questions are rolling in here for us. And I know Eric is able to join us as well in questions. And perhaps we'll just take a look here and start with a question for how does the integration coming in from the audience, how does the integration into Workspace ONE look like? Is there any difference in an on-prem or on-prem versus a cloud environment? I should be able to read it. It's right in front of me.
Yeah. So I can take that question. At the moment, the managed services platform and the Edge Visibility Portal integrates with the Workspace ONE cloud environment or the UEM environment. We are pulling data from the UEM console into our Edge portal, and a portion of that data, along with the device tracker data, is allowing us to integrate these very specific reports that we're developing, right? So not just one solution is telling the whole story. And this was the genesis for the reason of bringing everything in the Edge portal, as well as, you know, limiting it down to one single pane of glass. But we need multiple data sets combined, developing reports and stuff like that. The nice thing about SMG3's Edge portal is it is built on the Salesforce.com cloud and their communities application. Therefore, we can really pull in any API. But to answer the question in full, at the moment, we have not integrated an on-prem client for an MDM that goes for other MDMs out there, we would have to look into that specifically. So if that is something you would like to do or research a little bit more, we could find another time to talk through that. I would have to get smarter people on the phone. We need, we need our developers and our engineers on the phone to answer that question.
Eric, and we'll work our way through a lot of these. So of course, we'll try and answer everything in the session today. If we run out of time, we will follow up with submissions. Next question, I feel like this always comes through, and it's an important one. There's so much in lessons learned and in prioritizing here. Christina, there's a question here that's, what's the largest challenge you ran into when deploying mobile devices and or the device tracking solution? Can I hand that to you, Christina?
Yeah, Eric can attest, we've had a lot of challenges. So we started this journey of device deployment probably 4 or 5 years ago. And Eric will remember there was a day where I locked him in a conference room in one of our IT offices and said, this isn't working. We need it to work and nobody's leaving until it works. And we ordered a lot of pizza and had everybody in the room. But I think one of the challenges is really just what Eric talked about earlier about this kind of golden image. And that's going to be different for everybody because it's really going to be dependent on your Wi-Fi settings. So we went through a lot of Uni 1 versus Uni 2 versus Uni 3 channels on the Wi-Fi. We went through a lot of, how does this device work with our MDM? What operating system do we want to standardize on? And how do we, as Eric said, when devices ship from Zebra, that's not always the operating system that we want. It's what Zebra is deploying. So how do we back that down and get the correct security patches? So I think the initial challenges are around that standard image and making sure you get that right. Now, you're also going to have to work with your network team. You're going to have to make sure that those devices are working on your network. I think from a functionality perspective, when we first decided to deploy devices, we kind of did a roadshow and said, here are the devices at the time that Cerner had certified to work with their products. And we took those out and did a roadshow with some of the nursing leaders and said, here are the devices we have available. What do you think? So we got some feedback there. But we have a lot of governance meetings, a lot of application meetings with various groups to make sure that what we're deploying works, that the functionality meets the needs. So I would just say you really need to make sure you have those governance meetings, not only with your technical teams, but also with your nursing and application teams, because if you don't have those, you could get into a real mess of making adjustments that may not work for everybody. And if you get into having a separate configuration or a separate image for each and every unit, it'll be a support nightmare. So we spent a lot of time around having governance around those items so that we could get to the point of deploying device tracker in a seamless way. I won't say that we've had a lot of problems deploying device tracker because we did the work up front of setting those standard images. So when we put device tracker on, it was, here's how it's going to work, and it's going to work the same at every hospital. And it was just a matter of training at that point.
Thanks, Christine. Oh, go ahead, Eric.
Oh, I'm sorry. Just to add a little bit to Christina's statement about the early on challenges, I think the biggest challenge that we see, and it wasn't just with MedStar, it's with all our hospital or healthcare clients, is that long-term vision and planning for it day one, right? Knowing that these mobile devices are going to become more and more impactful on patient care and patient satisfaction, but building this foundation today to support what's going to happen to us 4 years from now. And that's really the key to a successful mobile deployment, is having that long-term vision, having a partner that's been there and can guide you through this. And because there are some pitfalls and some tragic pitfalls, as simple as the golden image, because if that's not done right, 6 months from now, when you try to go to a new workflow or a new deployment, you're now fighting that image. And Christina's right. We spent a lot of time in a room with knowledge transfer. A lot of questions were answered, a lot of trial by error. And we really worked through that till we got to that baseline. And then that baseline allows us to build. It's like building the foundation of anything, so that when change comes, because we prepared for change, and change was add device tracker, we can instantly deploy that, put it into a sandbox, test it, get through regression testing, and out to the production environment, we go fast. And that's a testament to MedStar's vision on what they need, Zebra delivering the device tracker application, and us working together as a team to get that out there.
But thanks. I ended up combining some questions. We had another question in the chat about selection criteria and how did you determine and differentiate the device you selected based on what was available in the market. And so speaking to governance and needs, obviously impactful to the success you've seen. There was a question in the chat, and I think it's important. We talked a lot about combining, needs at the clinical front lines, managing expectations on the IT side. And I, being a nurse myself, I might say that device tracker wouldn't be first on my priority of things to think it was important, but the reality is success is so related to it. Christine, can I ask you, what have clinical users seen as the greatest benefit to deploying this solution?
Well, I think to what Eric stated earlier, we're trying to take the burden off of nursing who are short-staffed and very important in our clinical settings, and take that burden of finding devices off of them and have the software to do this. So before device tracker, it was a little bit like a needle in a haystack. So we knew devices were missing, but imagine a large hospital campus with 4 or 5 buildings that are each 10 stories high. And we were saying, okay, go find the device somewhere in this large campus. We had no data to go off of. So with device tracker, we're actually able to give our IT staff the tools they need to find the devices quickly. So we give them the last AP that they were connected to. We give them this little Geiger counter on the tablet to actually alarm the devices and get them back. So I think from our nursing staff, I hope that they would agree that we're able to get these devices back in their hands quickly versus us maybe not ever getting the devices back in their hands because we were really searching for a needle in a haystack. And now we don't have to do that. We can go to the AP, find the device, and return it back to the nursing unit immediately versus days or weeks or never.
Which we all want to avoid the never. That I think it's a great answer to that benefit. It's the constant uptime. It's the being able to use it exactly when they need it and how they intend to use it. I think we've got time probably for 2 more questions. No, we're getting to the top of the hour. Let me just throw them out there. A question that came in is that when you mentioned having the Wi-Fi ready, there's a question is this a full wireless survey that includes RF frequencies, including CT machines, microwave, other hospital gears, and heat maps, recommendations on an app placement? It noted in the audience that it's their experience that even with a good DAS cellular and wireless solution, coverage is never quite 100%, unfortunately, sometimes in a hospital.
Yeah.
No, so
yeah, go ahead.
I can take that one. So yes, there is a time that you may have to do a full wireless survey of your entire facility to understand what are the challenges of your wireless network to support real-time applications, voice, secure texting, alert, alarm management. And it is our experience that with any voice solution that we almost require, and it's not almost required, we actually require that we do a voice ready assessment, which is a sample size of your wireless network to ensure the proper configuration, QoS, access point replacement. Some hospitals and others have hired SMG3 to come in and resurvey the entire facility, recommend software upgrades, firmware upgrades, access point replacement, things of that nature. And it will take into account microwaves, lead walls, everything in order to build the best wireless network. Now, we even go further in that golden image, and this is another gotcha with Android. When you first provision an Android device, you could provision it on the wrong wireless network. Android will look at 2 wireless networks at the same exact time. But if your voice network is only on your voice SSID and it's not on your guest network, but your device was provisioned on guest, it will find that guest network and voice will degrade, right? Well, it won't work. So with SMG3, build your golden image, understanding that is a complexity that we need to solve for. We will prevent that early on, and we will, as Christina mentioned, we can even tune your devices to the exact channels that they are running on. Our goal is, and will always be, that we are going to take the device out of the wireless network conversation. Everybody wants to blame the wireless on the mobile device. If every device is configured the exact same way, specifically to that wireless network, driven by the network team, then we can remove that device and say, these are all your settings. This is how it was supposed to be. And we can watch that traffic. Let's solve for the wireless network. And let's see if maybe we have an access point replacement. When a device stays on that wireless network, we give the end user experience something they're not used to and something they're expecting, right? And we're increasing adoption by making sure it's always on the network. So long answer to a short question, but Wi-Fi is important. It's got to be considered, and you got to do your due diligence what's specific to your facilities and your hospitals.
Thanks, Eric. I don't know if we'll be able to cover all parts of the next question, but I'm going to put it out there with the remaining time, because I think we talked about, I had to ask the question on clinical benefits, but this is a partnership. There was a question that came in, how does using Device Tracker impact your IT FTEs, Christina? And then there is an ask too that can we demonstrate how you would review the data presented maybe in a live demo setting as well, Eric, and we'll determine if that's feasible given our time frame here.
Mm-hmm.
Yeah, I'll just speak a little bit to the ITFD. So I don't know that it's like FTE wise, we haven't had an impact. So we haven't increased or decreased our FTEs. That being said, those FTEs do more than just device tracker. So they are desk side support. So they're doing, printer and PC maintenance and scanner. So they're doing everything. What this does, though, is give them the ability to do their job better. So before, like I said, they were searching for a needle in a haystack. Now they actually have data to actually do their job better. So we haven't had a direct FTE decrease or anything like that from this, but it does, like I said, give them the data to go out and do their job quicker versus not. And Eric, if we have time, he can pull up a portal, that kind of shows some of the examples of what that looks like from a desk side perspective.
Excellent. I think with that, Eric, are you pulling up a demo?
Yeah, I can do that. Just give me 1 second. I have to stop my share for a second.
While you're loading up your share, Christina, yeah. We talked about the devices not being found ever, but you did allude to the instances where phones get wrapped up in sheets. Are you doing any type of geofencing? There was an ask about that.
Not today. We've talked about that. Our devices do chirp when they lose the network, but it's not very loud. But we have certainly had an instance where devices rolled up in sheets. We've had devices go from one hospital to the other hospital via helicopter transport with a patient. So we've seen it all, but we don't have geocaching, but something we've been looking at to kind of make a louder alert when something leaves the campus. But if with device tracker, we're not seeing the ROI on that if we can keep the devices in-house, but if we continue to see that as an issue, it'll probably be something we'll look at.
Excellent.
All right, so we have no more open questions. I will give a brief overview with respect to everybody's time of the Edge portal. This is our demo user. His name is, or one of our demo users. His name is Wade Wilson. And as you can see, there are multiple tabs inside of the Edge portal that allow you to do a couple different things. I'm not going to go over all of them. I will touch on the ones that today are most important. Assuming we have a fully deployed enterprise system, what the Edge portal does is allow you to track your devices at a hierarchy level based on your privileges inside the system. So if you're at administrator level for your entire organization, you can see all the devices across every single one of your hospitals. But if you're only a local FTE doing the desktop support, as Christina said, you will only see those devices at your specific hospital. So we are quieting down the noise while increasing the impactful data we're providing to the boots on the ground. And that's important. We don't want them to waste time sifting through lost devices that aren't theirs or something like that. So we have a couple integration points at the main portal. they are our main site. Then you have 2 MDMs to choose from. So you can choose the SOTI environment, or you can choose Workspace ONE. In the case of MedStar, they have the Workspace ONE integration here. And internally in the Edge portal, device tracker is known as Pinpoint. The marketing reasons, other things, but it's known as Pinpoint, but it's relying on Zebra's device tracker application to run real-time APIs. And here is an example of some of the data sets that Christina had mentioned. Imagine the boots on the ground interacting with this portal using Zebra's tablet. It's important to note that you have to use Zebra's tablet. This only works either on a desktop, and device tracker really only runs on a Zebra tablet because it is their intellectual property that can communicate from device to device. So it would be my job to come online today. I'm looking at some of my reports. I'm seeing, there's some mobile devices that have been lost out in accounting, or maybe they're in marketing. And then I have a device that cannot be found today. I can click further into this report, and I can see my 10 devices that are in service, or I can come back and I can look at my one device that needs to be found. Now, the nice thing about the Edge portal and needing to find the device quickly, you get a series of information on here. Now, MedStar's information is fully present. So they have their AP friendly name, the department that they're in, the device name, right? As well as the last time it's been seen. But in the device, in Pinpoint and the device tracker application right on the portal, we can find this device here. You don't always have to jump out to Zebra's device tracker application. If you find the device, walk up to it, and it's, Eric went on vacation and you went into my office and it was sitting on my desk, you can simply change the state of the device here, put it back into service, put it on the charger, hit update, and the device will update itself. And with a 15-minute running counter, Zebra's device tracker database will feed their APIs to SMG3's portal. And if we come home, there's a good chance that this report has been updated. I will refresh it, but it will refresh and there we go. Our device is now found.
Eric, that's
this
probably
same thing goes if you want. You could call a device lost from here also, if you would like. So as you can see, this is very use the Geiger counter application and find the device. It's very unique in the way it operates. And from here, we can get all of our other reports that Christina was talking about. So there's a slew of custom reports that we don't represent on the demo. Finally,
Eric, in the interest of time, unfortunately, I think we're over at this point, and I think we could spend an extensive amount of time digging in here, but that's a follow-up
sounds great
for the continued conversations. But I want to thank everyone for joining us today, for the active engagements and the questions, and looking forward to the discussions to come. Eric, Christina, thank you for sharing your expertise.
Thank you.